Very good morning to all of you. Today we are going to discuss what type of bariatric surgery we should choose for ourselves. Because if we look into the internet, there are various kinds of bariatric surgeries available, maybe even more than 100 different types of bariatric surgeries, procedures are available. One gets confused. Which one is good for me? So basically, if we group these procedures, they are only of two broad kinds. One is restrictive, which would restrict you from eating too much. And the other type of procedures are combination procedures. Combination means some restriction plus some decreased absorption, or you can call it malabsorption. Now, when the word malabsorption comes, the fear starts building up in our minds. We don't want any kind of malfunction in the body, so that's fine. My take on this subject of bariatric surgery is that it should not be considered as a cosmetic procedure. Those patients who just want to lose weight for the sake of losing weight and otherwise they have no problem, I think there is no use getting the bariatric surgery done. And when the problem starts, when you think that obesity has gone to be a disease for you, so what are the diseases which go hand in hand with obesity? Diabetes, type 2, breathlessness, then cardiac problems, high cholesterol, hypertriglyceridemia, then sleep apnea, or knee joint problems. So anything which has got some relationship to your body weight. If you are suffering from any of these problems, or your weight is so much that it is stopping you from performing your daily routine activities, or maybe somebody has got depressed because of the increased weight, and that person is not going anywhere, not attending any social function, not even doing his or her business. That person is sick because of obesity. So we, the doctors, we are here to help the patients. So if you think that you have gone to be a patient because of your weight, come to us. Now, to choose. Restrictive procedures are like band, sleeve. These are the common procedures which are available these days, or even balloon. And the combination procedures, the commonest ones are the Roux-en-Y gastric bypass and the Mini Gastric Bypass. So this comes under the gastric bypass group. And there are other strong procedures like duodenal switch, BPD. I think we should not be talking about those procedures because they are not for the common population, only for very difficult cases where the weight is not going down with any other bariatric procedure, or for some special patients we choose those procedures. So we'll be discussing just which procedure has to be selected, either restrictive or combination. There are two types of procedures, as I already discussed, restrictive and combination, and there are only two types of patients as well. Number one, high volume eaters, and number two, low volume eaters. High volume eater, I mean to say, is a person who is eating too much in one go, like maybe 5 or 6 hamburgers in one go, or 3-4 chickens, or 10 chapatis, so that it's obvious that you're eating too much. And the majority of the patients do not fall in this group. The second group, which is the commonest group, is the low volume eaters. Most of the females which are coming to us, they belong to low volume eater group. Low volume eater, we would define those who are eating a moderate amount of diet in one go, like 2 chapatis or 1 or 2 hamburgers or maybe 3-4 pieces of bread. So, and don't put it all together. What I mean to say is either one of this, like either 2 chapatis or 2 burgers, or a moderate amount of diet. Why their weight goes up if they are just taking moderate amount of diet? It's very easy to blame ourselves. We are not eating healthy, eating too much of sugars, this or that. But the thing is, nobody wants to be obese. And you do some dieting also to lose weight, but we see very rarely you can succeed in this dieting or any other conservative procedures. So now comes which procedure we have to select. If you are a low volume eater, then we cannot restrict you too much. You are already restricted. You are only taking 2 chapatis. How much tight we can make you? If I make you too much tight, that would mean that you can take only 2-3 bites of something. I would say that's not natural. So maybe you might get depressed with that, or your brain will not accept it. You will try to eat something like ice cream, sodas, Coke, or coffee or tea. All the soft calories will go down easily with band or sleeve. So if you are a low volume eater, probably you need a combination procedure. That's only as per my experience, but I might be biased because I am primarily a bypass surgeon, but that's what's my experience. I have done a lot of sleeves also, but not many bands. So you should be perceiving me like that, what I am doing, but I am just sharing my experience. Low volume eaters, if I make them too much tight, my sleeve doesn't work very well in them, and they have high incidence of weight regain, because the time the sleeve dilates slightly, they start eating a moderate amount, like maybe not 2 chapatis, just 1 chapati. After about 1 year, they start gaining weight very easily. It's very easy to fail that. But for a high volume eater, our sleeves are working very well. Even in the 5th or 6th year, they are doing well. Because if somebody was taking 10 chapatis or 5-6 hamburgers, and now he or she is taking just 2 chapatis or just 1 hamburger, so relatively their proportion of diet has come down significantly, and their weight will definitely come down significantly.